Hi, my name is Amy Abelar, and I am a doctor of acupuncture and integrative medicine at Nurturing Touch. One of the fertility questions that I get that's the most common is patients trying to understand when their fertile window is. So let's take a standard 28-day cycle, which this is not going to be everybody, but if you have a standard 28-day cycle, generally you're going to be ovulating around the middle of your cycle around day 14. Again, this is not everybody. I highly recommend using ovulation predictor test strips to confirm that you are in fact ovulating on day 14 or 15 or figuring out whichever day you are ovulating. Side note, if you are on a 28-day cycle and you are not ovulating on day 14 or 15, if you ovulate on day 10 or you ovulate on day 18, your ovulation is earlier or later in the cycle than it really should be. And so if that is the case, then definitely get paired up with an acupuncturist who can help with trying to regulate that ovulation to bring it back more towards that midpoint. So just as a side tip for ovulation. So let's assume you're ovulating on day 14 on a 28-day cycle. When we talk about cycle days, that's the number of total days in the cycle. So cycle day 1 is the day that you start bleeding, and then your next period would be, again, cycle day 1, the day that you start bleeding. So the total number of days in your cycle is from day 1 when you start bleeding to then whatever day it is right before you start your next period. So that's going to be cycle days 1 through 28, 30 for that standard cycle. Could be longer, could be shorter if you have longer or shorter cycles, but as a normal regular 28-day period where you're getting a cycle once a month, that's going to be what would be a standard, what we're kind of striving towards as far as an ideal. And again, if your cycles are too long or too short, we can absolutely help with that, with regulating that towards that more 28 to 30-day cycle with acupuncture as well. So if you are ovulating in that middle of your cycle around day 14, most people are also going to then get cervical mucus for a few days prior to your ovulation. So if you have 2, 3, 4, 5 days of cervical mucus, then that's awesome. You want the more days of cervical mucus you have leading up to ovulation, the more chances that you have to conceive in a cycle. So if you only have 1 day of cervical mucus or 2 days of cervical mucus, then I would highly recommend, again, see an acupuncturist, someone who can help with increasing your cervical mucus production so that you are able to have more fertile days in your cycle. So, on a 28-day cycle, if you're ovulating on day 14 and you have cervical mucus, let's say that starts day 10, then day 10 through day 14 is really going to be your most fertile window. So what I recommend for couples who are trying to conceive is start trying every other day between the day that you see cervical mucus, the first day that you see cervical mucus, and then every other day up until you get your positive ovulation on a test strip, and then 1 more day after that. So if you are ovulating on day 14 and you start cervical mucus on day 10, you're gonna try day 10, day 12, day 14 when you ovulate, and then again on day 15. It does take about 36 hours or so for men to generate a full load of semen again. So that's the reason why you don't need to be having sex 3 times a day or once a day. Really, every other day is going to be sufficient for that regard. So those are the main tips as far as the days that you have for your fertile days in your cycle when you are trying to conceive on a 28-day cycle. And if you are interested in learning more about trying to conceive within your regular cycle that falls outside of that normal 14-day ovulation and 28-day cycle, then follow for more videos.